ZOLGENSMA, onasemnogene abeparvovec-xioi, is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
Aniya has SMA. She has 4 backup copies. We had the visit with her pediatrician, and at that time, she had looked over Aniya and said, you need to get to the neurologist. It was very time sensitive for her, and we had to move forward. We got the genetics testing back, and we found out that Aniya has 4 copies. I would not say that slowed us down any. It did give us some hope to her disease. Her neurologist was always very clear to us. Just because of her 4 backup copies did not mean she did not need treatment. Given the fact of your child could be losing motor neurons that they will never regain, I would say that should not slow you down with getting a treatment option in place. I knew that ZOLGENSMA was the right decision. Will and I had sat down and discussed all of the treatment options. We had just made the decision off of knowing that it was a one-time infusion.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
Insurance denied ZOLGENSMA.
She has 4 copies, so you gotta fight a little harder.
Aniya had some symptoms of SMA. She has tongue tremors. She couldn't bear any weight on her legs. When you have to fight for your baby, it does things to you. It changes you in ways that you cannot imagine. You get this sense of strength that you didn't know you had. And Aniya gave us all of that.
Just don't ever give up. April 27th, Aniya got ZOLGENSMA, and it was just a release of tension, or the stress just gone. The waiting was just all gone. We were just so happy and overjoyed that she finally got ZOLGENSMA.
The day that Aniya received ZOLGENSMA was the best days of our life. Thinking of Aniya walking into her first day of school brings so much joy to my heart. That first day of school that your baby has is a milestone. And to know that she's walking through those doors on her own and she is gonna conquer the world.
She has 4 copies. You gotta fight a little harder. When they say no, you gotta go above and beyond that. You gotta keep going and keep going. Don't take no for an answer. And our baby, our daughter, she got her medicine and she's walking and running and dancing. Every baby deserves it.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. Zolgensma is given as a one-time infusion into a vein. Zolgensma was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about Zolgensma? Zolgensma can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with Zolgensma and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with Zolgensma? Infections before or after Zolgensma infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with Zolgensma. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after Zolgensma infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There is a theoretical risk of tumor development with gene therapies such as Zolgensma. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after Zolgensma infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and Zolgensma? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to Zolgensma administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of Zolgensma may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with Zolgensma. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of Zolgensma? The most common side effects that occurred in patients treated with Zolgensma were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.